Stridor, a distinctive throat wheeze, can indicate upper airway issues. This high-pitched sound, often louder during inhalation, suggests narrowing or blockage in the throat area, such as due to swelling or a foreign object. Understanding the differences between throat and chest wheeze is crucial. While throat wheeze typically points to a more immediate concern, chest wheeze is often associated with conditions like asthma or COPD and presents more during exhalation. The location of the sound provides significant clues. If stridor is observed, it is vital to assess if the sound is persistent or joined by other alarming symptoms. Knowing these signs can guide when further medical evaluation is needed.
Throat wheezing, or stridor, occurs when airflow is obstructed in the upper airway. This can be due to various causes, such as an allergic reaction, epiglottitis, or inhaling a foreign object. Unlike chest wheeze, which involves the large airways of the lungs, stridor is indicative of a condition affecting the throat or neck areas. When the airway narrows, whether from an acute cause like choking or a chronic condition like vocal cord dysfunction, it produces that sharp, whistling sound. This can be alarming, especially if breathing becomes difficult. Recognizing that stridor is more pronounced on intake of breath can help differentiate it from other types of wheezing.
First, pay attention to the timing of the wheeze. Throat wheezing, or stridor, usually occurs during inhalation, while chest wheezing is more common during exhalation. Second, listen to where the sound is loudest. If it is most noticeable in the neck, it might be stridor. If it resonates from the chest, it points to a chest wheeze. Lastly, connect this with possible recent events or conditions. Throat wheeze could follow a severe allergy or inhaled object, while chest wheeze might be related to asthma or a respiratory infection. Understanding these patterns aids in deciding when to seek medical intervention. Always seek medical care if you're unsure or if stridor is accompanied by difficulty breathing, blue lips, or severe chest pain. These indicate urgent issues. For mild wheezing related to known conditions like asthma, follow your treatment plan and consult your doctor if symptoms persist or worsen. Using devices such as nebulizers can help manage lower airway wheezing. However, these won't address obstacles causing throat wheeze. Clear differentiation and communication with your healthcare provider are key. Medical disclaimer: this video is for informational purposes and does not replace professional medical advice. For more information, consult your healthcare provider or visit our website.